Electrocardiograms, or ECGs, are a commonly used monitor in veterinary medicine. In order for us to use an ECG properly, we should be able to ultimately explain what an ECG measures, identify where the ECG leads are placed for our most commonly used ECG lead, which is a lead 2 rhythm. We should describe how lead 2 records electrical activity and understand how that activity becomes a rhythm strip. ECGs record the heart's electrical activity. It does not measure heart contractions. However, they are represented in some of the electrical activity. The electrical activity is picked up by our electrodes or leads and taken to the ECG machine and converted to a rhythm strip. The electrical activity causes the contraction. So the ECG tells us about rhythm and conduction of electrical activity, but again, doesn't really tell us about contraction or mechanical activity of the heart. So why a lead 2? Lead 2 is the most commonly used lead in veterinary medicine. It is the best lead for us to evaluate the heart rhythm and identify arrhythmias. It most closely aligns with the normal direction of depolarization of the heart. So this gives us tall, clear P waves and a QRS complex that's easy to read. So what is a lead? The lead is a viewpoint. It's not really the wires themselves. So the lead is where we place the wires to detect the electrical activity. Each lead records electrical activity between two electrodes. It will measure the direction of electrical flow and the voltage of that flow. Lead 2 compares the negative electrode to a positive electrode. Lead 2, the most important leads are the right arm and the left leg. So lead 2 configuration. Lead 2 records the electrical activity from a negative electrode at the right forelimb and a positive electrode at the left hind limb. This aligns with the heart's normal depolarization pathway of the right atrium to the left ventricle. So when placing the electrodes in small animals, we look at the right forelimb, which is typically our white lead. Always double check. The colors don't always correspond, but we have a right forelimb, a left forelimb, and then a left hind limb. Again, the most important components for a lead 2 are the right forelimb and the left hind limb. Oftentimes these can be placed in the elbow region or in the axillary region, even around the stifle or the inguinal region. What does the ECG machine then see? The ECG detects the electrical voltage differences between those two electrodes. So when electricity moves toward the positive, you get an upward deflection, and when electricity moves away, you get a downward deflection. And if there's no movement, that's where we get our flat line or the baseline. The electrical activity of the heart, as a reminder, the sequence of depolarization is that the SA node fires, the atria depolarize, the AV node has a slight delay, the ventricles depolarize, and the ventricles repolarize. Each step in this pathway creates a wave or segment on the ECG. The P wave is atrial depolarization. So the electrical impulse travels from the right atrium toward the left hind limb, and it results in an upright P wave in lead 2. The QRS complex is ventricle depolarization. There's a large muscle mass, so there's a large electrical signal, and the direction towards the left left leg electrode, so we get a tall upright QRS. The T wave is ventricular repolarization. The direction is more variable. It can be upright. Sometimes we see it inverted in certain animals, but it's still considered normal depending on the species and the individual animal. So to put it all together, our lead 2 is depicted by a P wave with atrial depolarization, a PR interval, which is AV conduction, QRS complex, ventricular depolarization, and a T wave, ventricular repolarization, all from the right arm to the left leg. So why does it matter if we place the leads in the correct place? Incorrect placement can cause inverted waves or abnormal amplitudes and can cause us to misdiagnose things. So we always want to confirm that we have the correct limb, we have good contact, and that the animal is not moving much. So what would we do for next steps in our education? We would want to identify normal and then start to identify abnormal rhythms. We want to practice ECG interpretation and compare lead 2 to other leads and see what those are.